So NHS Highland is a remote and rural health board, and from a pharmacy point of view, an important thing is we have plenty of dispensing practices. So these are practices that dispense medicines without a pharmacist being there. There were two national documents that came out. One was Prescription for Excellence, the pharmacy strategy, and the other is the control of entry legislation, both of which said that dispensing practice patients should have pharmacist input. So we started a project a couple of years ago, and we demonstrated that a pharmacist going out to the dispensing practices, reviewing people's medicines and advising them on their medicines improve pharmaceutical care. But as I said, we're a remote and rural board, we're spread across a massive geographical area, and actually getting pharmacists physically to all the different dispensing practices was a real challenge. So we thought, well, what can we do with telehealth? And so that's where we come to this project. So we're using two types of telehealth. We're using Vision Anywhere to provide pharmacists remote access into the records, into the GP practice, so that they have the information they need to provide a medication review. And we're using Attend Anywhere, which is a remote video consultation program to allow the patient from where they are to consult with the pharmacist face-to-face, but by video conferencing. So when we started the project, we knew that we needed to get remote access for the pharmacists into the GP practices, but we didn't really know how to do that. We'd looked at a number of different options, so things like WebExing into the records and other ways of connecting. And it was at this time that our eHealth department suggested we looked at Vision Anywhere. So we saw a trial of it, and it made a lot of sense to us in terms of kind of the layout and how it looked from the pharmacist's end, but also all three of the practices we had were already using Vision, so it really nicely fitted with what they were used to using already. So the implementation overall, I think, has gone well. There have been problems. I should be really honest, with any project like this, you're starting with a brand new system. None of us really knew what exactly we were doing at the beginning. I think there were some issues with connections involving our internal sort of NHS Highland networks and how to get Vision Anywhere working within the kinds of connections that we had. So that's taken a little bit of time. And there have been a few teething problems with sort of how things work within Vision Anywhere and getting used to how things work. Having said that, the support that we've had from Vision has been fantastic. We did have an issue and people actually came in over the weekend and helped to fix it, and we couldn't have asked for more support than what we've had. So I think overall it's gone well, despite these kind of like getting going problems. So what the pharmacists do is they have open a consultation up with the patient. They bring Vision up on the screen. They've got their video consultation on half the screen and their Vision Anywhere on the other half of the screen. So they have a look through the important parts of the records, so looking at the medical history and particularly focusing on the medication history as well. They perform a full medication review, which is based on the National Polypharmacy Guidelines, and then they make any changes to medicines that are required. So they may update the prescription, they'll always be reauthorising repeats, but they may also make changes, prescribe something new, take something off the repeats, and then they'll provide advice to patients as well. And then obviously closing that down, and then that goes back in to the patient's record at the other end. I think it's absolutely worked in terms of the ability to do that, perform all of those different functions. There have been a few issues with coding because the coding works in a slightly different way, and I know that's something that Vision's working on, and I hope that will be fixed, because if we could get that little bit fixed, I think the whole system would really work well. I think the pharmacists who are using it all say it's interesting in that they're all very experienced Vision users in practices, so they're really used to the way that Vision is laid out in the practices. Obviously this is laid out in a slightly different way, but as sort of experienced computer users in general, it's actually quite intuitive to use, and they're getting on well with it. So it's early days. This is a project we're 1 month into it being live to patients, so it is a little difficult to say about what I think the benefits to patients will actually be from patient feedback, but what I think they will be are improved access to a service that the patients wouldn't otherwise have access to, and also benefits to the patient like not having to travel, because we might have been able to provide this service but they would have had to travel several hundred miles in order to attend an appointment. So I think there's a real benefit to patients there in terms of bringing services close to the patient's home. In terms of benefits to the health board, we are able to provide a pharmacy service across our geographical area, which is a huge benefit. We have problems with recruiting professionals into remote areas, so this allows us to provide a service into those remote areas where we might have had a gap otherwise. In addition, the pharmacists, if they were to travel to all these remote places, would have spent a lot of time in a car driving, and actually to be able to spend all their time on a clinical role rather than driving is a benefit for us all. I think in terms of kind of the future, we see this as a way that we will provide a service in the future in a number of different locations. For example, I have another team of pharmacists who provide specialist support. So if a patient's had a fall, they'll provide a medication review very quickly after that fall to see if medicines were a contributing factor. And at the moment they have to travel to the GP practice in order to do that. If they were to get a phone call and say, can you have a look through someone's medicines, if they were able to do that at a distance, they'd be able to do it really quickly and instantly, and that's a big benefit for the future. In terms of the wider health board picture, already based on kind of talking about this project to colleagues, I've had interest from GPs, from nurses, from allied health professionals of all different kinds, people wanting to replicate this model of this kind of dual telehealth approach about getting services into remote areas and using the telehealth to reach patients.